Hello, this video is for the midterm, the speech motor system and how it relates to motor speech disorders. And we will start with flaccid dysarthria. Flaccid dysarthria is caused by the damage to the final common pathway. It is a damage to cranial or spinal nerves. Uh, Flaccid dysarthria is a problem of neuromuscular execution and not a problem of planning, programming, or control. Speech characteristics occur because of muscle weakness and reduced muscle tone. It affects speed, range, and accuracy of speech movements. Flaccid dysarthria speech characteristics are hypernasality, breathiness, monopitch, nasal emission, harsh voice quality, short phrases, and monoloudness. Sample 91 is a great example of flaccid dysarthria because the patient demonstrates breathiness, short phrases, nasal emission, and monopitch in his speech. Now let's move to the spastic dysarthria. Spastic dysarthria is a deficit in direct activation pathway and indirect activation pathway. It is caused by bilateral damage to the direct and indirect activation pathways of the central nervous system. Central nervous system controls movements patterns rather than isolated muscle movements. Spastic dysarthria is associated with impaired movement patterns rather than weakness of muscles. Generally, in spastic dysarthria, all of the speech valves are affected. Major disturbances include slowness and reduced range of individual and repetitive movements, reduced force of movements, and excessive muscle tone. Sample 8 is a great example of spastic dysarthria because we can hear strained voice quality, which is often present during vowel prolongation in people with spastic dysarthria. The next one is the ataxic dysarthria. It is associated with the damage to the cerebellar control circuits, and it can be seen across all levels of speech, especially in articulation and prosody. It is a result of incoordination and some reduced muscle tone. Reduced muscle tone results in slowness and inaccurate force, range, timing, and direction of speech movements. Ataxic dysarthria is caused by motor control issues. Clinical characteristics of speech are slurred speech, inaccurate, slow movements, hypotonia. Slow rates is caused by hypotonia and reduced muscle tension. It delays the start of muscle force and slows the range of muscle contractions. Great example of ataxic dysarthria we can find in the sample 12. We can hear unsteadiness, mild alterations in loudness and pitch. All of these are present during vowel prolongation in people with ataxic dysarthria. Now let's talk about hypokinetic dysarthria. So, hypokinetic dysarthria is associated with the damage to the basal ganglia control circuit. The primary influence of the basal ganglia control circuit on speech is through its connections with motor area of the cerebral cortex. Imbalances among neurotransmitters are responsible for many motor problems associated with the basal ganglia control circuit malfunction. It is most evident in voice, articulation, and prosody. We can observe problems of motor control such as preparation, maintenance, and switching of motor program. Uh, Patient's perception of their voice includes that their voice sounds weaker or quieter. It is hard for them to get the speech started. The rate of speech is too fast sometimes, and also they have complaints for swallowing. And reduced range of movements is the most problematic neuromuscular deficit. Sample 16 is a great example of hyperkinetic dysarthria. We can hear there reduced maximum vowel duration, reduced overall loudness, and breathiness. All of these are often observed in people with hyperkinetic dysarthria. Now let's go to the hyperkinetic dysarthria. Hyperkinetic in general means too much movements. Hyperkinetic dysarthria is the most common of the dysarthrias. Spasmodic dysphonia and organic voice tremors are 70% of all cases. And again, hyperkinetic dysarthria is the problem in the basal ganglia control circuit. All of these are included in the basal ganglia control circuit. It's not totally understand for now, and parts of the circuit inhibit movements, other parts excite movements. Um, Hyperkinetic dysarthria most prominent in prosody and rate. Deviant speech is abnormal, rhythmic, or irregular and unpredictable, rapid or slow involuntary movements. And a good example of hyperkinetic dysarthria is a sample 72. We can observe there quick, unsustained movements of shoulder, heads, and lips. And this is Huntington disease, which is also a part of hyperkinetic dysarthria. And the last one is the apraxia of speech. It's a neurologic speech disorder. It is a disturbance in the higher level of planning and programming. It occurs after the damage to the left cerebellar hemisphere, which is responsible for the linguistics attributes of speech. Patients with this disorder have normal verbal and reading comprehension, but impaired capacity to plan or program sensory motor commands. It means message is ready, but muscles just don't go. Um, Prosody and phonetic systems are most impaired. And sample 79 is a good example of nonverbal oral apraxia. We can observe grouping of target efforts to achieve movements or postures and vocalization as a part of or in place of the target. Thank you very much.